verify if a person was vaccinated in case one turns up claiming that they have lost their vaccination card. And Seona is asking Dr. Bruwer, can you explain why population immunity from vaccines is a speedier option for Namibia than it is to wait for herd immunity to determine? What is the difference?
Okay, so I think you're going to have to remind me about some of them, but we'll go through them. I think they're all important aspects. So with the question around breastfeeding and pregnancy, you'll have to ask the gynecologist managing your pregnancy. I know there are some studies now that it is safe in pregnancy and it can be used, but again, the recommendation would be to first consult your gynecologist or the doctor managing you, because again, it's not a blanket, yes, every pregnant lady can be vaccinated, but yes, and in breastfeeding, yes, they can. Why we can say that is there are many patients that ended up during the trials of these vaccines ended up becoming pregnant during or after the vaccination, and then we saw, okay, listen, it's actually quite safe. So and then they sort of pulled back and said, okay, let's see what happens. So there are some small studies being done in pregnant patients. So the recommendations are coming out that pregnant ladies can be vaccinated, but again, rather speak to your gynecologist. I'm not a gynecologist in that case. With regards to the question of why not let the herd immunity just let the virus go its natural course and lead to herd immunity. So you've got two problems there. The one is we mentioned the impact it will have on our society. I mean, the amount of death we'll have allowing this virus to spread, because the more people get infected, the more death we will have, even if it is a small number. And so we want to prevent that from happening by using the vaccine. But also the second thing is that natural immunity does not necessarily give you lasting protection. That's what we mentioned with this 3-month period. So we know with pretty good certainty that you'll have immunity for at least 3 months, and most probably for at least 8 months. After that, we cannot guarantee that you have immunity. There is sort of immune memory that probably will play a role, but we don't know about the robustness of that, and we can't test for that immune memory after that 8-month period, if you want to call it that. And what is of concern is also we have been seeing cases who've been coming back with a second infection, and we've actually last week, maybe the week before last, I lost my first patient who came back with a second infection. So even that does not necessarily protect you. She was actually about 3 months, just more than 3 months. Yeah, wow. Yeah. She had it sort of at the end of January, beginning of February, and that time I don't know exactly this year, and then now again. So that's a problem with natural immunity. It does not give you a guarantee. Vaccination immunity also doesn't give you a guarantee, but at least it improves the chances, and that's why we're advocating for more vaccinations. So
that's quite frightening, and that really motivates me to get vaccinated, even though I've had coronavirus and I've got antibodies, as soon as it's safe to do so.
Yeah, absolutely.
If I got one question, Doctor, just sent by Angel Tommy asking, how can one verify that a person was vaccinated in case he or she turns up and claim that they lost the vaccination card?
So again, I about the administration thereof, I don't know. Just in my personal experience, I went for my vaccination, the first vaccination at Windhoek Central Hospital, and then I thought I'm going to take a shortcut and I'm going to go for my second follow-up vaccination at Katatura Hospital. And I got to Katatura and I was sitting there, and after 20 minutes, I gave in my card, you get the vaccine card, I gave in my card. After 20 minutes, I'm sitting no, nothing's happening. So I'm walking and looking, and there they're paging through the registry and saying, okay, but I haven't been vaccinated there. So I said, oh no, I wasn't there. I was at Windhoek Central. So there is actually record kept of the patients who are vaccinated, and it gets saved. So in my case, I know it happened like that, and I suppose if you lose your vaccine card, the records will be there, and you could go back and say, I was vaccinated on this day at this place, and they would be able to access that
Can I
information.
quickly understand something? It's not electronically stored. It's manually stored, so you must go back to the place where you were vaccinated.
Listen, I don't know. I think there is an electronic database. I was I was in the first sort of group, so at that stage it was manually. I don't know. Maybe it's electronic now. I am
We're
not.
going to have a discussion at 8 o'clock on Clubhouse, and we'll have somebody from the Ministry of Health, and we'll ask them the question about how it's being managed.
And just before I hand back the discussion, Madam First Lady, Doctor, there's a common question around steaming here.
Yeah, I think the long and the short, or the easy answer there is doesn't really make a difference. The possible benefit of steaming is that when you get coronavirus, one of the effects of the coronavirus is that it thickens your mucus, your secretions quite a lot, and just by steaming it might loosen the secretions a bit and get you to clear it a bit easier, but it won't. The initial thought was increasing the temperature will kill the virus and protect you, but it makes no difference. At